Hi, folks. Today is Friday, May 1st, and I'll say that April was the longest 10 years of my life. I'm sure it may have been for you, too. I put out a memo today, and it was started with a quote that I heard from somebody, and if it was you, thank you. I can't remember where I heard it, but it was that we're all in the same storm, but we're in different boats. We're all experiencing this pandemic differently. For some of us, we're just desperate to get out and drive our car, and for some of us, it's about seeing a daughter or son. For some of us, it's just the opportunity to exercise more, or just the opportunity to have more control in our life. And I will tell you that for our staff team, those of us who do go home to a different home at night, we have the same challenges. Right now, the world is so small, and keeping our world small is what's keeping us as safe as possible. And we're going to have some challenges going forward. First of all, many of us are control enthusiasts. It's quite possible that absolutely everyone who lives and works here is a control enthusiast. That sounds better than control freak to me. And being someone who likes control in a world where right now none of us have that. Right now, with no really rapid testing, with no antiviral that's effective, with no vaccine, the most we can do is to be patient and stay as tight and as small as possible. So there are things you can do, and we need you to do, and that is wear a mask when you're around anyone else. That's for the other person, not for you. It's to stay 6 feet apart. It's to wash your hands at every single opportunity, and it's to keep your social circle small. So we understand that that's what we can do right now. Our residents and our staff. We expect that the governor will today announce potentially some changes in the stay-at-home order, or even if he maintains that, announce some changes in what businesses would be allowed to open up. That adds some complexity for us. We will lag whatever the state does. And we will lag that because the state will open up around economic decisions. They need people to go back to work. People need to go back to work. We don't need that here, right? You have your basic needs met from a physical side, and we understand that mental health is just as important. And what we will do is really focus in the next few weeks, and we've started to talk with some residents in Exeter and Durham, and we will in Manchester early next week, to get a handle on how the mood is and what you're thinking. But whatever we do, it's going to take us a little while. We need to hang in there as tight as possible for as long as possible, because that keeps the virus out. And it's an insidious virus. I can't think of another word. We don't have a treatment plan. We don't have a vaccine. All we can do is keep it away from us for as long as possible. So with that in mind, we are starting to think about sort of an opening up plan, which would also come along and be partnered with a quick shut it down again plan if things turn bad. We're going to do some testing again next week. Voluntary independent living resident testing will happen in Manchester on Monday and Durham and Exeter on Tuesday. That will tell us some things, but nothing tells us everything right now, because it'll take a few days for results, and we'll start to understand more, and we'll make better decisions when we understand more. But again, it's not ultimate knowledge. And we will also on Monday retest our healthcare staff at Birch Hill, because that is something we can adjust if we find that we have more folks who are testing positive. We have, over the course of the last few weeks, since we did our initial testing, we have had additional people in Birch Hill's Healthcare Center show some symptoms. But right now, the difficult part is every symptom, the symptom set for this virus is so wide and varied that every symptom could be. So that's exactly how we're treating it, that everyone who's living in healthcare, we treat it as they're positive, and we do everything that we would do if we had a confirmed case. On the staff side, obviously, if someone does test positive, we take them off the schedule or replace them. And what I've seen this week is just a beautiful outpouring of commitment from our nursing staff that normally works in Exeter or normally works signed on to work in RiverWoods Durham, who are willing to go over and supplement that staff so that we can keep units segregated, so we can keep nurses and nurses' aides working with a small group of people, and so that people can get a break. So I'm super proud of what it means to be a family of communities. I've seen that over the course of these past 8 weeks, where people are just working together, ideas, equipment, thoughts, commitment to one another. You may not know it, but you're the beneficiary of great ideas from staff that works at a campus that is not your own. And it's something I'm super proud of, and it's who we are. So for the next, 30 days probably, we're going to think about things that we can change and adjust, and we'll do some small things, but we really do need you to hang in there with us. The longer we stay safe, the longer we stay without any positive cases on our independent side, without any positive cases in our Exeter healthcare, the tighter we can get at Birch Hill in their healthcare and try to contain any spread, the better we all are. And it is not easy. It's not easy for any of us, but we are in this together. So we're all in for you. We know you're all in for one another and for us. And that's what this is about. So thank you. Stay healthy. Wash your hands.